Hello and welcome to Shine Chats. My name is Steve Kess. I'm the Vice President of Global Professional Relations at Henry Schein, and I have the distinct honor to chat with my dear friend, Dr. Ray Cohlmia, the Executive Director of the American Dental Association. Welcome, Ray.
Good to see you, Steve. Thank you.
Great to see you. We want to talk really about Give Kids a Smile and its impact on the clinical community, the public, and also from an ADA perspective, what the program has meant over these past 20 years. I'm going to ask you a few questions, and as always, let's speak from the heart and be casual about it.
Okay.
Great. So the dental profession has evolved immensely in the 20 years since the program has begun. How has patient behavior changed in 20 years, and how does the impact in the way practices operate differently today than they might have 20 years ago?
You know, Steve, the dental profession has evolved immensely in the 20 years since Give Kids a Smile has began. The patient's behavior in 20 years, when we think about what's happened. So it's not just about the patient changes, but many things have changed so much in the last 20 years. Okay, let's talk about them. We have impacts from technology, generational shifts, a large array of practice modalities, and boy, I'll tell you, consumers with demands like we have never seen before. Unfortunately, in a not so positive format, there's a fifth one that I say is staffing resources is becoming a little bit of a challenge as well. But when we look at today's patients and really what they expect is the ability to discover and embrace their own healthcare, and they're doing it in ways like they've never done before. So when they access their immediate records and the demand for the instant health communications platform, well, basically, in other words, they want answers when they want it and in a format that they want with increasing digital demand. I'll tell you, yeah, things have really changed in the last 20 years, and there is no doubt that things will change in the next 20 years for sure.
And from the perspective of Give Kids a Smile specifically, has there been much change in how the programs were implemented either at the doctor or dentist office or then as they are now?
Oh, yeah, Steve. When it was formed back in 2002, it was really centered around a single day of providing care. Now, today, Give Kids a Smile, it's not just a one day thought process, it's becoming a way of life for our profession. Events are happening throughout the entire year. Even more, a large part of our coordinators are now reporting that they're providing continuity of care that is way past their traditional one day Give Kids a Smile event. We're seeing more and more programs moving from just screening and education to actually providing preventive and restorative care. Even more, Steve, as a former dean of a dental college, I can tell you that this movement is even impacting academic institutions where Give Kids a Smile program, it's becoming a part of their curriculum. It's part of our culture now. It's amazing how our professional values are shining through from seen from the very start of their education all the way through their entire professional lives.
And do you see that as strongly with new clinicians coming into the profession, students in dental school? They're more diverse. They have a different orientation toward the profession. How do you see that changing?
Steve, one of the aspects of our profession is advancing the arts and sciences to all people, to everywhere. That's what our job is. Secondly, in years past, the study of the health of our population, it relied more upon the hands of the public health programs. Today, it's pretty much basic work in our dental schools of today. It's actually in our curriculum. So this better helps us to manage more and more complex diseases, many high-risk populations. This is going to continue to be where we will be more ingrained in overall healthcare delivery. There's no question in my mind. And we're going to continue to play a higher role in primary care as we move into the future. Dentistry is now becoming, it's not just about oral health care, it's becoming healthcare as we approach the future. So you're going to see an increased demand. It's an educational trend that's happening in our colleges right now, and it's becoming a predominant part in our actions and what we do each and every day as a profession.
So you would say that the profession is encouraging expanded enrollment in the profession by a broader base of community, as well as the community itself, the schools, the association at the local, state, and national level, all contributing to a celebration, perhaps, of
Right.
access and diversity.
Yeah, it's the Give the Kids a Smile. It's been a driver for patient engagement and healthcare information dissemination. We have dentists and many dental team members that are regular participants in schools and other community events that continue to further help carry the word and culture of healthcare. Further, Steve, we even note countless numbers of generous dentists that provide follow up care to those children in need in their practices for no cost. Best of all, it brings the opportunities of building a relationship with the entire family and many of the individuals they work and play with on a regular basis. When we think about what our opportunities are, is that this movement is creating a bigger public health movement. People are knowing about this more than ever before. Not just the fact that we're teaching in schools, but it's becoming a regular way of life. And I'm seeing that across the nation.
Do you see that the dentist and the dental team that is engaged in providing access to underrepresented populations, like during Give Kids a Smile events, do they build a esprit de corps, and is that esprit de corps being transferred and recognized by the patients who are not from this community?
Yeah, yeah. When you look at the uniqueness of the program, Steve, it's that it is focused on children. It's an effort that starts from the ground up. It provides assistance and resources, and where work is done at the community level. That is one of the biggest things about this. Really, Steve, when we look at it all, it would be that it's a true spirit of a grassroots program. We've seen it move from a community level to a national movement. Henry Schein has been critical to help us guide and shape the program to what it is today, because I don't really consider it a program anymore. It's almost like a culture. It's a way of life. It's who we are. It's such a common thought process to say, give kids a smile, not just on a daily basis, but thinking about it year round. It never leaves our mind. But the bottom line is with partners like you, we're going to see the smiling faces of over 7 million children. And Steve, I'm hoping that we have continued support from all of our partners, because we're looking forward to serving many more millions and millions of smiling faces in years to come. That's what I'm really excited about. It's amazing how Give Kids a Smile is such a common name as we think about it, all starting back from the initial thought process back in 2002 and now becoming a regular way of life for what we're doing. We're reaching the communities that aren't getting care on a regular basis, Steve. But that is the idea. Remember, 40 to 60% of our population does not receive dental health care on a regular basis. Those are the ones we need to work on. That's what it means to advance the arts and sciences to all people everywhere.
It's a great message, Ray, and I can't imagine anyone being more engaged and genuinely enthusiastic about this entire health equity, diversity movement. You certainly have always walked the talk, and it's great that you're in the role that you have now in influencing both the profession and its impact on oral health for the country, and even for the world on that level. From my point of view, we really appreciate the spending of time together, and from Schein's point of view, Give Kids a Smile is one of the most successful public-private partnerships that we've ever been involved with, and had the privilege of working so closely with the profession. And having you as the executive director for the future, I think we're in the best hands possible. And so, again, thank you for coming on. If you have any closing comments you'd like to make, we'd love to hear.
Thank you to you and Henry Schein. You all make dreams a reality. That's our goal, is to treat more people, is to get people to have more oral health care. We've got a long ways to go, but each day that we work towards this vision and dream that we both have in common is what allows us to do this. I'm excited about what tomorrow brings. I'm also excited about the opportunities and challenges that we have before us in order to make sure people's lives are better. That's indeed what our job is to improve people's lives, Steve. So thank you and Henry Schein and all the partners for their support and Give Kids a Smile.
Thank you, Ray, and thanks for joining me today on this chat. And I think a tremendous amount of clarity and purpose has been accomplished by this discussion. Have a great day and all the best.
Thank you. And to you too, Steve. Thank you.